The main goals in spine surgery are two. The first one always is to decompress the neural tissue. Why? Because the neural tissue is the tissue that takes all the information from your brain to your body. So if that cable is compressed, it can lose function. And then you will have sensitivity, for example, or strain in your hand or in your legs. So that's the main goal for me as a neurosurgeon, to decompress the neural tissue. And the second goal is, in case we cause instability because of the surgery, we have to stabilize that segment. Or in case the patient already had instability, that can happen sometimes, we plan a surgery to decompress the neural tissue and also gain stability to that segment. That can happen in the lumbar spine, lower back, or in the C-spine. Mostly all the cases in the C-spine, mostly, not all, but mostly, we do an approach, an anterior approach, an incision, a transverse incision in the neck. We gain access to the C-spine, take out the disc, and our goal mostly of the cases is to put a prosthesis. The difference between a prosthesis and a cage, for example, those are two kind of implants, different. One has movement, so we keep the normal movement of the spine, and the other one fuses the spine. We are enemies, my team and I are enemies of fusing the spine, because when you fuse the spine, you get a block of very stable segment, but the segments above and below that segment with the fusion had hypermobility and can fail with time. So what we use mostly are the prostheses in order to gain that movement and preserve that movement of normal movement of the spine. And also in the lumbar spine, we use the system Cosmic Mia, which is a dynamic system, who has a hinge between the head of the screw and the thread. It's a hinge which allows the normal flexion and extension movement between the segments where the screws are, avoiding the translation or rotational movements, which can cause pain. And that's a very, very wow. I think it's a very good innovation of European, German engineers there. So I love that system because it doesn't fight against nature. And once we decompress, we stabilize, well, we can expect the results to be excellent in the patients.